Good afternoon. My name is Alicia Maxwell, and I am here to present a new program that I have created to serve the wonderful residents of Calhoun County who struggle with mental health disorders and have not received the proper mental health care and or services they need. The new program is called A Pathway to Mental Wellness, a program designed to help Calhoun County residents receive mental health care and services without barriers. So, without further ado, let's get into it. I created a pathway to mental wellness because mental health affects each one of us. How we think, act, feel, and connect with others depends on our mental wellness. The individuals of Calhoun County who struggle with mental health disorders such as anxiety and depression have not been getting the proper care and services they need. As an advocate and human services professional, it is my duty to attempt to create a program that will help those who struggle with mental health issues and reduce the challenges and barriers that have been in play for far too long, and to increase and encourage positive and healthy mental wellness for everyone. So, what is the purpose, mission, and goal for the program? The purpose is to raise mental health awareness and advocate for improved mental health care and services. The mission is to promote mental wellness in Calhoun County by providing access to mental health care and services. And the goal is to take a holistic approach to increase mental wellness in the community and decrease challenges and barriers for adequate mental health care. Here we have some of the barriers that prevent the adult population from receiving the mental health help that they need: poverty, uninsured, lack of transportation, and a mental health professional shortage. After much research, I have learned that Calhoun County falls below the state and national average pertaining to per capita income. The socioeconomic status of Calhoun County consists of a per capita income of $32,567, which is below the state average per capita income of $37,993 and is below the national average at $43,289. The median household income for adults living in Calhoun County, South Carolina, stands at $56,690, which is below the state's average at $66,818 and below the national average at $78,538. Adult residents of Calhoun County struggle with receiving mental health care and services are due to uninsured individuals and the affordability of care. The methodology research performed by Calhoun County reports that 12.4% of the population do not have health insurance, which is above the state average at 12.3% and is above the national average at 11.5%. More specifically, Calhoun County has a 14.6% uninsured rate among adults ages 18 to 64. Calhoun County is situated in one of the many rural areas in South Carolina, meaning public transportation is limited or restricted from allowing individuals without a vehicle proper access to mental health care. Over 27% of the population in South Carolina lives in rural communities, and about 20% of those live in poverty. Individuals without access to a vehicle have increased by 4% within the last decade. Calhoun County is the number one county in South Carolina with the least access to mental health care. Reports show the county has 7,083 residents for every mental health care provider. With a significantly higher residents to provider ratio, adults with a mental health disorder are not receiving proper mental health care or services or may experience delayed or inadequate treatment due to the mental health shortage. This new pro- this new program will include various opportunities for community residents longing for adequate mental health care and services. A pathway to mental wellness will provide evidence based counseling by top mental health professionals, crisis intervention workshops, benefit and resource information for low income families, transportation, preventative initiatives to reduce risk factors and increase productive measures, and child care services. For an example, an individual may be experiencing a form of anxiety because they do not have anyone to watch their child so they can receive mental health services. A pathway to mental wellness will be equipped with certified and licensed child care professionals to relieve a little stress or anxiety for individuals with children. Additionally, the program will offer a holistic approach and consider various factors impacting a person's emotional and physical well being and spiritual and social lifestyle. Lastly, this program will be affordable and ensure everyone receives the mental health care and resources that they have been waiting for and deserve. Let's meet our staff. A pathway to mental wellness will consist of top of the line professionals who will ensure quality care and customer service to all clients. On staff will be a clinical psychologist, licensed clinical social worker, mental health counselor, an outreach coordinator, a marketing specialist, a benefits specialist, a human resource administrative assistant, a life and wellness coach, and a certified child care professional. Let's meet our contractors. A pathway to mental wellness has partnered with local and worldwide contractors to ensure program compliance, safety of all staff and clients, and the cleanliness of our facility. Our contractors include Amazon, the Bud Group, the Crisis Consulting Group Incorporated, TPX, Richardson Plowden Attorneys at Law, and the South Carolina Contractors Licensing Board. A pathway to mental wellness aligns with community needs because for far too long there has been a lack of quality mental health services in the area. Geologically, Calhoun County is located in a very rural area. Therefore, services are limited and mental health facilities are too far for those residents who may not have access. Transportation or cannot afford to pay for services due to low income or other circumstances. This new program will provide transportation for those who need it. This program will also be geared toward low income individuals, hence, they too will have an opportunity to receive quality care. And this program will provide mental health professionals to serve in underserved areas such as Calhoun County. Additionally, the program will include community engagement activities, fundraisers, art events, food drives, and mental wellness activities to foster a community-driven program inclusive to everyone in the community. This program will require the efforts of the whole community and other prime stakeholders such as the Lexington Medical Mental Health Services, Medical University of South Carolina Behavioral Health, and the Orangeburg Mental Health Clinic, which are all located in counties within 30 to 45-minute range from Calhoun County. If we take an all hands on deck approach to introducing and getting this program up and running, we can drastically improve the lives of others. By working together, we are reducing the mental health crisis that has been prevalent in the state of South Carolina for far too long. Reports show that South Carolina is ranked one of the worst states for mental health services. Let's change that narrative by providing much needed mental health services, one rural community at a time, starting with Calhoun County. A pathway to mental wellness will acquire funding through several sectors, including first-time donors, repeat donors, donations, potential funding sources, state and federal funding, and community fundraising events to help raise money to serve our clients. First, I would like to thank all of you for listening to this presentation and welcoming me to share a pathway to mental wellness with you all. However, I need your help. All of us must come together and make this program a success for our community members who depend on us. We can make this program successful with state and federal funding, monetary donations, volunteers willing to work if needed, but most of all, we need advocates. We need advocates willing to publicly support and speak out for those who may not have the courage to. We need advocates willing to sacrifice and advocate for a cause that has been swept under the rug for far too long. Let's work together to strengthen our state regarding providing quality mental health care for all South Carolinians, starting with the great Calhoun County. I need you, the community needs you, the state of South Carolina needs you, but most of all, those who are suffering from mental health issues in Calhoun County that have come across challenges and barriers to receive the mental health care needs you. Again, my name is Alicia Maxwell, and I would like to thank all of you so much for tuning in. Have a great rest of your night.